Hello, I've put together some information to help to explain one of the therapies that I use in my clinic called EMDR. And EMDR stands for Eye Movement Desensitization and Reprocessing. It was founded in 1987 by Francine Shapiro, so it's a relatively new psychotherapy, but it is being used in the NHS, and it's cited in the NICE guidelines for recommended therapy for treatment of post-traumatic stress disorder. It can be used on any trauma or any disturbing life experience that is causing you emotional distress in the here and now, and it enables you to heal yourself from those symptoms. So some traumatic events could be road traffic accidents, serious assault, abuse, terrorism, military combat, neglect. Also, it could be things that have happened at school. It could be an embarrassing situation, being frightened, isolated, everyday memories that are causing low self-esteem or powerlessness. If you have some symptoms of trauma, these might include sleep disturbance, intrusive memories, withdrawal of people, places, upset tummy, anxiety, panic, hypervigilance. So those are some of the symptoms that you may have, but there are lots of other symptoms as well. So studies have shown that EMDR helps benefit people in a very quick time to help heal from the psychological trauma of a difficult situation. Very similarly, actually, to how the body recovers from a trauma such as a cut. So if you cut your body, it heals. So you have the cut on the hand, it heals relatively quickly. If there's a foreign body, a spelk in the hand, a little piece of wood in the hand, then it could continue to cause you pain. Once that is removed, then the healing does start. Just the same as EMDR, once the emotional block is worked on, then the healing starts to put into place, and then you start to feel a lot better very quickly. EMDR is often explained using a model called the Adaptive Information Processing Model, or AIP for short. So if you think about the mind and how it works, so this helps to explain that memories are interlinked in your mind using networks. So if you think of networks, a little bit like roads linking together from similar thoughts and sensations, emotions are all linked together and they're strengthened together. So when we experience something new, the memory is then merged, integrated with an old memory, and then new associations are made and developed. So in the event of us experiencing something that we've never experienced before, something that we can't compute to, which is upsetting, negative, a really traumatic experience, then the information processed in our minds is often incomplete. And this can result in strong feelings about the event and some dissociation occur. So not thinking about specific parts of the event, or perhaps not thinking about the event at all. So as a result of the incomplete information processing, the event isn't processed, it doesn't connect to other memories and doesn't merge fully in the kind of the storage room of our brain. So it's not processed completely. So the memories is called dysfunctional. It's not processed completely. It's not stored usefully in some parts. So this can result in the memory being triggered by similar situations, or the event being thought about regularly. So we can experience feelings of reliving it, intrusive thoughts about ourselves, very strong emotions and physical sensations. So if you think about it in an everyday situation, so if I help to explain, if you think about somebody who's an administrator, perhaps in a big company, gets all the documentations from people who work there, and their job is to store the documentation in a filing system that works in the correct place where people can take it out when it's needed, that the documentations are stored with similar documentation, so it's easy, quick, and it works. So on the whole, things are filed very well together, but occasionally the administrator might be given some documentation that doesn't quite fit into their system. that's incorrectly labelled or handed to them in an incomplete fashion, or they can't understand part of it. So the administrator will do their best to store the documentation correctly, but may find that they do put it in the wrong location. So it's mixed in with unrelated work. It could be placed in the top drawer, and then every time the top drawer, the filing cabinet's opened, it keeps making a reappearance, and the administrator remembers it needs to be stored but not quite sure where to do. So it irritates, it's quite irritating. So that's similar to how our memories are stored. Most of the time they're stored in the right place, but occasionally we don't know what to do with them. We can't understand them. So going back to our own memories. So EMDR processes the different elements of the event to reduce and alleviate the distress caused by images, thoughts, emotions, physical sensation. And the processing helps the disturbing or unprocessed memory to merge and to link with other processed healthy or adaptive information or memories. And once this occurs, once it's in the right place in the filing cabinet, then it's stored. It's healthy, it's there, it doesn't keep popping up when we don't want it to, it's helpful. So once this happens, the distress is relieved and the bodily symptoms are reduced. So what actually happens in EMDR? Well, it's not like a talking therapy where we talk a great deal about past things, those past situations. What we want to do is to put you in a helpful place where you're ready to deal with some of the maybe intrusive situations, difficult situations, and then we process them. So we process them so that the brain can put them into the proper area, the helpful area of the brain, and so that you can move on. It doesn't keep coming up for you. So we follow a certain process, and we typically look at 3 periods of time. So that's past, present and the future. The past being the disturbing memory or the event. The current is things in the here and now that are causing you distress. And the future would look at the skills and the attitudes that you require for more positive future actions. So it allows you to do things that perhaps you wouldn't normally do because of how things are affecting you. So firstly, the first phase 1 is the history taking. So we take time to discuss what you'd like to work on, the treatment plan we call it. So we look at the specific targets or the situations, the events that you would like to work on. And if there's quite a few different targets, we could maybe prioritise and work with the ones that would mean the most to you, would have the most effect to you. We'd also discuss the skills and behaviours you would need for future situations. The next phase is the preparation. So this is phase 2. So make sure that you have all the resources that you need to be able to work through the active phases of the process. So this might include self-soothing techniques, grounding, relaxation, practicing those in between sessions to make sure that you're feeling okay and prepared to start the active phases. Then phase 3 to phase 6 is the active stages. So this is where we process the situations. So this includes the assessment, desensitization, installation and body scan. So what that means is I get you to identify a visual image of the memory, negative belief about self, identify the emotions, bodily sensations attached to that, identify a positive belief that you would like to think about yourself, rate these, then get you to focus on the image, negative thoughts, bodily sensation, while we use bilateral stimulation. So you were asked to either watch my finger moving from side to side with your eyes, so moving your eyes from side to side. Some therapists have a light bar, so you watch the light from side to side. So keeping your head still and moving the eyes. Sometimes we use tapping, so tap your hands or your knees. I use tappers or buzzers, so you'd hold a tapper in each hand. It would vibrate from side to side. So every different therapist use a different kind of technique. then you can just notice whatever happens. So you have dual concentration on the eye movement as well as the image, thought, memory, or whatever comes up. And this helps you to move this process, this memory, this thought. If you do become stuck at any time, that's fine, to help you to move on, and we'll continue the process. So until no distress is reported, no unusual physical sensations. And then phase 7 is the closure phase of that. So reminded at the end of the session to note down, to log any disturbance, any memories, anything that's popped up for you in between sessions. Perhaps we'll do some grounding exercises, some relaxation exercises. Obviously in between sessions you may continue to process the information, so to use these relaxation exercises, grounding techniques that you've already learned. To use your calm and safe place whenever you need to. Some people find that the process more in between sessions because there's a resistance in between sessions. Some people feel emotion in between sessions, and some people don't feel any emotions at all. Everybody is very, very different. Sometimes some people may feel a little bit tired because you've worked on some deep information there, some deep situations and emotions. So it could be a good idea to have a bit of a rest after the session. Don't do anything strenuous. Perhaps go for a walk, listen to music, have some quiet time. Sometimes people do ask, well, a lot of the time people do ask, how many sessions do I need? And obviously this is a question I can't really answer. Obviously to go through the process of EMDR, it's very useful to do the whole protocol. That's recommended to have the most effective outcome. People have had different sessions. It could be only a few sessions if it's a one-off trauma or one-off situation. If it's multiple, if there's childhood difficulties, lots of attachment issues, or really complex, then it could take a lot longer and more intensive preparation work. So everybody's very different. Some studies have shown that 90% of single trauma victims no longer have post-traumatic stress after 3 90-minute sessions. Other studies have shown that after 6 50-minute sessions, 100% of single trauma were free from post-traumatic stress, with 77% of multiple trauma were free from post-traumatic stress. Others have shown that 77% of combat veterans were free post-traumatic distress after 12 sessions. But different research varies for different people, and it's best to keep maybe 6 to 12 sessions as a recommendation. Some people have less and some people have a lot more. Any side effects? Well, with any psychotherapy, obviously there is emotion that comes up, so you might feel a little bit of emotion after the session, but this will reduce. Will you relive the trauma? Unlike some therapies, we don't go over, we don't relive the trauma for long periods of time. The high levels of intensity only last for a short amount of time and reduce very quickly. And of course, you will have learned some tools to help relieve any distress if they could become too intense for you. Some people who I've seen before for hypnotherapy often think it is similar to hypnotherapy. But there are things that are likened with any psychotherapy that you use. Some tools and techniques can feel very similar, but there's very distant differences between these two therapies in particular. So typically when practicing hypnotherapy, the client is taken to an altered state of mental relaxation. So you're feeling deeply relaxed. With EMDR, mental relaxation isn't typical. In fact, attempts are made to reconnect with the anxious or disturbing mental state or feeling, whilst the client very much is guided to stay in the here and now, so grounded actually in the here and now. In hypnosis, the client develops a high focus, a state of aroused receptibility. In EMDR, the client remains in dual focus on the past and present. So you can focus on the positive and negative, current held beliefs, as well as any emotional arousal. brought by imagining the worst part. One of hypnotherapy's effects are utilising the client's imagination, thinking outside of the box, creating things in a different way, perceiving things differently. In EMDR, it very much helped to feel grounded, perceiving how you perceive it. So asked about current feelings, current bodily sensations, so kept very much in the reality of the room, in the here and now of where you are. So hopefully I've helped to explain a little bit more about EMDR and what you would expect to receive in therapy. EMDR is a fairly recent psychotherapy. It's growing in popularity because of the NICE guideline recommendation, all the research that's done. There are lots more information that you could look up on the website by putting in any Google search. But if you have got any questions, anything that you would like to ask, please feel free to contact me, and you can email me on julie@symmetrytherapy.co.uk. Of course, all my contact details are on my website, which is www.symmetrytherapy.co.uk. Okay, thank you, and I look forward to hearing from you if you've got any remaining questions. Thanks. Bye.